Curare, derived from an indigenous South American word for poison, was originally used by tribes as arrow poison for hunting made by burning plants like Chondrodendron, tomentosum, and strychnine. European explorers, including Christopher Columbus, encountered it in the 15th century with reports of poison arrows, leading to its study in Europe. In 1800, Alexander von Humboldt documented the curare preparation process and proved it was deadly only when entering the bloodstream. By the 20th century, scientists discovered that curare works by blocking receptors to relax muscles. Its first clinical use as a muscle relaxant in surgery was in 1942, when Harold Griffith used it during an appendectomy. This marked a turning point in modern anesthetic practices, transforming curare from a trivial poison into a revolutionary tool for safer surgeries.
फार्माकोकाइनेटिक्स ऑफ क्यूरेयर। फार्माकोकाइनेटिक्स में जो फर्स्ट स्टेप है वो है इसकी एब्जॉर्प्शन का। एब्जॉर्प्शन दो तरह से हो सकती है, तो ओरल रूट से या फिर पेरेंट्रल से। पर ओरल रूट से हम लोग इस ड्रग को इसलिए नहीं देते क्योंकि ड्रग जीआईटी में बहुत पुअरली एब्जॉर्ब होती है, और पेरेंट्रल रूट से हम लोग इसे दो रूट से दे सकते हैं, तो आईवी से या फिर इंट्रामस्कुलर। एज़ कम्पेयर टू आईवी, इंट्रामस्कुलर थोड़ा सा स्लो है क्योंकि ड्रग डायरेक्टली डिफ्यूज़ हो रही होती है फ्रॉम मसल इनटू ब्लड स्ट्रीम। नेक्स्ट है उसकी डिस्ट्रीब्यूशन। क्यूरेर का वॉल्यूम ऑफ डिस्ट्रीब्यूशन ये है कि वो एक्स्ट्रा सेलुलर फ्लूइड में ही रहती है और फैट या सेंट्रल नर्वस सिस्टम में डिस्ट्रीब्यूट नहीं होती। क्यूरेर ब्लड ब्रेन बैरियर को क्रॉस नहीं कर सकती। इसका रीज़न ये है कि ये ड्रग का हाइड्रोफिलिक करेक्टर है और लार्ज मोलिकुलर साइज है। नेक्स्ट है प्रोटीन बाइंडिंग। क्यूरेर 50 to 60% प्रोटीन्स के साथ बाइंड करती है, और क्यूरेर और प्रोटीन्स के दरमियान वीक इंटरमोलिकुलर फोर्सेस बाइंडिंग में इनको कंट्रीब्यूट करती हैं। क्यूरेर निकोटिनिक एसिटाइलकोलिन रिसेप्टर्स पे एसिटाइलकोलिन को ब्लॉक कर देती है, जिसकी वजह से मसल पैरालिसिस भी हो जाती है। नेक्स्ट है उसका मेटाबॉलिज्म। क्यूरेर पार्शली मेटाबोलाइज होती है लिवर में, और उसके सिंथेटिक डेरिवेटिव्स की अगर हम बात करें तो उसमें एट्राक्यूरियम और वैक्यूरोनियम। एट्राक्यूरियम हॉफमैन एलिमिनेशन के थ्रू मेटाबोलाइज होता है, और वैक्यूरेनियम जो है एक्टिव या इनएक्टिव इसके मेटाबोलाइट्स हो सकते हैं, और ये लिवर में मेटाबोलाइज होता है। लास्ट है उसकी एक्सक्रीशन। क्यूरेर किडनीज के थ्रू एक्सक्रीट हो जाती है। एज़ कम्पेयर टू क्यूरेर, इसके सिंथेटिक डेरिवेटिव्स में एट्राक्यूरियम किडनीज के थ्रू एक्सक्रीट होता है, और वैक्यूरोनियम बोथ यानी हेपेटिक और रीनल रूट्स बोथ से मेटाबोलाइज हो सकता है।
Curare acts as a competitive antagonist against acetylcholine on nicotinic receptors at neuromuscular junction. In normal conditions, when acetylcholine binds to the nicotinic receptor, ion channels open and depolarization occurs, and hence action potential is generated and the muscles contract. But when curare occupies the binding site in place of acetylcholine, ion channels are not opened. So the sodium ions cannot enter the cell and the potassium ions cannot exit. This means no depolarization occurs at all. Without depolarization, no action potential is generated. As a result, the muscles cannot contract, leading to the unresponsiveness to the nerve signal. Firstly, the smaller muscles like the muscles of toe and eyes are affected, and then it progresses to the larger muscles of arms and legs. Low dose of curare causes mild to moderate muscle relaxation. In case of overdose, it can paralyze the diaphragm, leading to the respiratory failure if not managed with artificial ventilation. Onset of action of curare depends on the route of administration. If it is intravenous, then the action will occur within 1 to 5 minutes. But if it is intramuscular, then the action is slow. The effect of curare can be reversed by acetylcholine esterase inhibitors like neostigmine. Actually, the acetylcholine esterase inhibitors inhibit the action of acetylcholine esterase, means that they increase the concentration of acetylcholine, which then competes with the curare and binds at the nicotinic receptors.
Next, the topic is properties, which include physical and chemical properties. First point is that alkaloid is an chemically organic compound which basically consists of nitrogen atom. They are the potent biological effects in the human and the other animals. For example, Chondrodendron tomentosum, a tropical plant, contains a curare, which is an alkaloid-based toxin, and its alkaloid is a D-tuba curare, and its appearance includes brown to the black tar-like consistency due to the presence of the alkaloids, plant-like resins, and the other related compounds. Some of the drugs may be the aromatic, like they have the odor strong, pungent, and the bitter. They produce the aroma by extraction of aromatic compound and plant-like resins. D-tubacurine is off-white powder when in crystalline form. Its crystalline form is prepared by the processes like excretion, purification, and crystallization. Its mechanism include acetylcholine and the curare act as a competitive inhibitor in binding to receptor site. First point is adverse effects. It also causes diplopia, which is due to the muscle weakness and affects the routine tasks like the drinking, eating, running by affecting the ocular movements, and the person see double image of the object. Second one is that if the curare is overdosed, it results in difficulty in the breathing, low level of the oxygen, and the high level of carbon dioxide in lungs. Third one is cholinesterase inhibitors that blocks the enzyme acetylcholinesterase and increases the acetylcholine to activate the muscle contraction. Fourth one is tolerance, which occurs when we take the medicine but does not produce as much effectiveness as we take the previous. It causes hypersensitivity, which includes bronchospasm caused by the tightness of the chest, wheezing, difficulty in the breathing, and also results in the allergic reactions like the itches and the rashes. And contraindications when no medication or prescriptions are prescribed by the healthcare provider.
Therapeutic uses of curare. Curare is widely used in combination with general anesthesia to ensure complete muscle relaxation during surgical procedures. This muscle paralysis is essential in surgeries where control over muscle movement is needed for precision and safety. It facilitates endotracheal intubation by relaxing the muscles for the placement of tube in the throat and airway, allowing easier placement of a breathing tube. Curare reduces the need for high doses of anesthetic, lowering the risk associated with prolonged exposure to general anesthetics. Treatment of muscle spasm manages muscle spasms caused by neurological conditions such as tetanus or cerebral palsy, provides relief for patients with involuntary muscle contractions, improves quality of life for patients with muscles, respiratory support, facilitates mechanical ventilation for patients with respiratory distress, ensures adequate oxygenation, and prevents respiratory failure. Supports critical care patients who are unable to breathe on their own. Clinical uses of curare. Use in surgery. Muscle relaxation during abdominal, thoracic, and orthopedic procedures. Facilitates surgical procedure by providing precise control over muscle movement. Enhances surgical safety by reducing the risk of complication. Now, the use in critical care facilitates endotracheal intubation in critically ill patients, supports mechanical ventilation in patients with respiratory failure, manages muscle spasms and seizures in critically ill patients, uses as anesthesia. Adjunct to general anesthesia to reduce anesthetic dose, enhances anesthesia safety by reducing the risk of complications, provides smooth and rapid induction of anesthesia. Here are the merits and demerits of curare. Merits: effective muscle relaxant, facilitates intubation, reduces anesthetic dose, neurological use. Demerits are respiratory paralysis, lack of analgesic effect, narrow therapeutic index, allergic reactions, and short duration of action.